Senator Hassan.
Thank you very much, Mr. Chair and Ranking Member, for this hearing. Thanks to our witnesses, not only for being here today, but for the work that you do. And I just want to start by following up a little bit on what Senator Kaine was talking about. I think we all have been hearing from constituents about concerns about mental health, in particular children's mental health. I will tell you that in the spring of 2021, when schools in New Hampshire began to reopen more fully, I went and visited in one of my local school districts with a mix of students and teachers and administrators, students from first grade all the way through high school. And I was struck towards the end of the discussion when we had been talking about how kids were doing, how their families were doing, what the schedule in school felt like, did they feel that they were keeping up with their learning, how the year had been, when a girl who must have been about 10 turned to me and said, "So, Senator, what are you doing about mental health?" Mm-hmm. And I had been kind of dancing around it. I'm from a generation where we didn't talk about mental health in the same way we talked about so-called physical health. Then recently, another one of my constituents, Laura Lee, who is 18 years old, raised awareness about mental health because she was driving with a friend one day and the friend had a panic attack. And Laura Lee didn't know what to do. So now Laura Lee is working to help students get that kind of understanding for mental health first aid. What can kids do to help each other in these moments where they need to be supported and until they can get professional help? So I also want to encourage young people to know that when you speak up, your representatives hear it, and we're doing our best to listen, and we are trying to make progress. And I want to ask a couple of questions to our witnesses about some of the progress we've made. Sometimes it doesn't seem enough, fast enough, but it is really important to understand the building blocks that maybe are in place. So let me start with a question to Dr. Murthy. I really enjoyed our discussion, Doctor, in my office yesterday, and my team appreciated it very much too. Last year, my colleague, Senator Ernst, and I led something called the Stand Up Act, which was passed into law. And it's a law that helps ensure that schools are using suicide prevention policies that are actually evidence-based. So, Dr. Murthy, why is it important for schools to adopt policies that are evidence-based? Senator Cassidy was just talking about our schools using the resources we're giving them in the right way. Why is it important that they're evidence-based, especially given the increased mental health risks that our youth face from social media?
Well, thank you, Senator. And Laura Lee's story will remain with me, and something I want to say about that at the end. But specifically to your question, having evidence-based practices is important because sometimes even with the best of intentions, our programs may not have the desired effect. Right. Either in terms of the extent of impact or in terms of who they're impacting, they may leave certain people behind. The only way we really know that is to study them. The other piece is that sometimes when we study programs well, we realize that there may be unintended consequences of those programs. It may help in some areas, actually harm in others. Right. And that's the whole point of studying these programs and then making sure that people know what the evidence tells us so that the program, when they do finally invest resources, time, and effort, they can do it in programs that we have greater confidence will actually help.
Yeah, good. So let me then ask a question to you, Ms. Nees. This is another example coming out of New Hampshire. Our University of New Hampshire and Manchester School District, which is our biggest school district in New Hampshire, they're leveraging funds from the Bipartisan Safer Communities Act to train and place 80 graduate students studying social work in high school, in high needs schools, high schools and elementary and middle schools. These graduate students will benefit from a year-long internship with on-the-job training while public school students receive needed services. So, Mrs. Nees, in addition to this innovative example from my state, what other innovative local solutions are you seeing school districts deploy to address the school mental health personnel shortage?
Senator, one of my favorite questions. We've seen some really innovative things across the country. We were just in a school in Delaware where the Children's Hospital runs a clinic that's on the campus of the school. The majority of these children in this elementary school are homeless and live in nearby shelters. The year before the clinic was on staff, they had more than 1,000 instances of disruptive behavior that resulted in suspensions. The first year of the center, that 1,000 number went down to 100, and now there are virtually none. It's a great partnership. The Children's Hospital staffs it, does all the billing, and the school provides the physical space. What the principal said to me, I said, "What keeps you up at night?" And he said, "Learning loss." He said, "We've got the support for kids, and that the teachers don't have to be both therapist and teacher."
Right.
And that the staff there help teachers figure out how to get through the day to support kids so that they're emotionally okay and learning. And I think that's one of the greatest things that we're seeing is that partnership between educators and mental health providers on behalf of children where children are.
Well, thank you very much. Thank you, Mr. Chair, for your indulgence. I have some other questions, too, including the importance of providing services in summer programs and summer camps, which is something I think I'll follow up with our witnesses on. And lastly, again, to the young people watching, this hearing probably wouldn't be happening if young people hadn't been speaking up. So thank you all very much for that.
Senator Smith.